It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everybody, and welcome to another live round of Katz's Corner here on WABC. If you have a question about prostate health or bladder health, pick up the phone on 1-800-848-9222. That's 1-800-848-WABC. We had a lot of phone calls last week talking about urinary tract infection, and I have two very special guests in the studio with me today, and we'll be talking a lot about urinary tract infection, what causes it, why men and women are prone to urinary tract infections, why are some more prone to others, what can we do to prevent it. Dr. Katz is away today having a well-earned rest, but with me in the studio I have Dr. Amy Howell, who is an excellent cranberry researcher who's committed a lot of her life to talking about how to prevent urinary tract infections and researching prevention. And I also have Dr. Tina Wu, who's an emergency medicine doctor at NYU, who's going to be talking with me about urinary tract infections. Before we get to the phone lines, I want to remind everybody again about our Men's Health Seminar, Father's Day weekend, Saturday, June the 15th. And we will be giving out the number later in the show. If you want to register, you need to go to menshealthseminar.com. And for those of you who are not on the telephone, not on the internet, go to 516-663-9615 and Joanne will help you register. That's 516-663-9615. Dr. Katz and I will be talking a lot about prostate health, prostate cancer prevention, sexual health, sleep health, cardiac health at the Men's Health Seminar, and places are filling up very quickly, so please come and join us. Men's Health Seminar, Father's Day weekend, Saturday, June the 15th. And before we get to the phone lines, welcome, ladies. Thank you very much for joining me in the studio. Welcome, Dr. Tina Wu and Dr. Amy Howell. Great to have you back in the studio again.
Thanks for having us.
Now, last week we had a lot of telephone calls about urinary tract infection, so hopefully some of those callers will be back in touch with us. But urinary tract infections are the second most common bacterial infection, second only to the common cold. And in America, I understand that 18 million urinary tract infections sufferers per year, 1 million women, chronic urinary tract infection sufferers, having at least 3 or more a year, and both men and women are affected by urinary tract infections. This is a huge problem, isn't it? Very, very common problem, and actually causes a lot of distress for patients, results in often quite a few hospital admissions, and also for many people, many days off work. Tina, tell us a little bit about this.
Absolutely, and it affects people of all different ages. Kids get urinary tract infections for different reasons. Teenagers, women in their 20s, and then men and women that are elderly get urinary tract infections, and it can be absolutely disabling. And I see about 10% of my patients every single day have a urinary tract infection. It's very, very common.
And certain patients are more prone to urinary tract infections than others. Before we talk about some of the risk factors, tell us why women are so much more prone to getting infections than men.
So women are more prone to getting urinary tract infections because they have a shorter urethra. And a urethra is essentially the passageway to get from the bladder out. So it's essentially a small tube that carries urine from the bladder outside the body, and women's urethras are much shorter, which means that bacteria can get from the outside world into the bladder more quickly.
And this affects all ages. You've mentioned children as well as teenagers and older patients. But men are also very prone to urinary tract infection as well. I mean, I see a lot of men in the practice, and certainly many women coming in complaining of recurrent urinary tract infections. Let's talk about some of the risk factors that affect both men and women.
Sure. So one of the biggest risk factors is one, diabetes. So any sort of disease that impacts your immune system causes you to get more urinary tract infections. And 2, also people's lifestyle choices. So whether or not you urinate after sex, whether you are doing methods to prevent urinary tract infections, diet is very, very important to preventing urinary tract infections. What you drink, what you eat, how you live, it's very important to take care of that bladder health.
And then sometimes we see other risk factors like kidney stones that predispose people to infections and other medical problems that can result in infection. And I understand, if you've had an infection, a urinary tract infection, it makes you more prone to another infection, doesn't it?
Yes, absolutely. Once you get one urinary tract infection, and most people, they don't remember the urinary tract infections as a child, but then when people are in their 20s, their teens and 20s, they get another urinary tract infection, and then for the next 2, 3, 4 years, they'll keep getting recurrent urinary tract infections. And it's very, very bad for your urethra, what I talked about before, and your overall well-being.
Okay. I was also very interested in what you were saying about patients that we're admitting to the hospital. We're seeing more and more antibiotic resistance worldwide. And the problem here is that many patients who are diagnosed not just with urinary tract infections, but with chest infections and other infections, the antibiotics are often not working to kill these infections because we've developed resistance, and therefore many of these tablet antibiotics are not working. We're having to admit patients, particularly elderly patients, for courses of intravenous antibiotics. And hospitals are dangerous places. We know that when patients end up in hospital, particularly the elderly, they often end up having other problems. And just talk a little bit about that, Amy, about resistance with urinary tract infections and resistance to antibiotics and why this is such a big problem.
Well, as Tina mentioned, these patients, they get over and over and over, they get these infections. So it really takes over their lives. And they are looking for answers. And the problem is they keep going to their primary care physician or urologist, and they keep getting put on these antibiotic regimes, either to prevent infections or to cure them. So they are experiencing, across the board, massive antibiotic resistance. So if they go and they get another illness, a lot of times the antibiotic won't work. So with cranberry, the interesting thing is that several studies have been done that show if patients can stay on the cranberry to prevent infections, not treat, but prevent, that they can avoid completely this resistance issue that's associated with low-dose antibiotics. So my goal as a cranberry researcher is to try and convince people to switch and go on to cranberry on a daily or close to daily basis to really prevent this problem.
And with cranberry, patients seem to know a lot about this. They often come in and saying, I've heard that cranberry juice is good for your urinary tract health. Talk a little bit, please, about cranberry juice versus all the cranberry pills that are out there. How do patients choose which is the best cranberry supplement? And what's your advice about cranberry juice for urinary tract health?
Well, it's interesting, and this goes for pretty much any consumer product, dietary supplement out there. There's a full range of products available, from juices to powders to dried fruits, and people are seeing them everywhere, and they don't know what to choose. And the problem is that these are unregulated, and actually just functional foods that have a health component to them really do need to have more regulation by the FDA. And right now the FDA waits until someone gets sick. So the problem is you need to find something that's going to work effectively, have the active component. And the active component in the cranberry is a compound that helps prevent the bacteria from sticking to the bladder wall. And this is the initial step in the infection process. So you are not killing the bacteria as an antibiotic would. You are preventing this sticking step. And so, therefore, the bacteria are literally washed out in your urine stream.
Hold it there, ladies. It's 1-800-848-WABC. That's 1-800-848-9222. We're live here in the studio. It's Katz's Corner. You're talking with me, Dr. Philippa Cheetham, on 1-800-848-WABC. And we have some calls, so let's go to the phone lines. We have Ralph calling from Queens with a question. Good morning, Ralph. Do we have Ralph on the line? Okay, I think we've lost Ralph. Let's go to Mary in Manhattan. Good morning, Mary.
Oh, good morning, Dr. Cheetham. How are you? Listen, Dr. Cheetham, I called you a week ago about my father's PSA. September 2011, his PSA was 1.86, and I had it done last week. It went up to 5.86. Now, when it was 1.86, I used to give him this herbal prostate combo that had saw palmera in it, pycnogen, and stinging nettle. But once the PSA went to 186, I said, well, I don't need to give it anymore. And, of course, I stopped it. And I was just wondering, do you think if I go put him back on that maybe the prostate will go down? Now, before 2011, they had him on a pill called bicaltamate, but I took him off of that pill, and they used to give him an injection. But I felt that 92, he didn't need that anymore. So what did you suggest? Should I be concerned that it went up to 4 points?
Well, thank you very much for your call, Mary. Mary is a very loyal listener of Katz's Corner. Her father is in his 90s and he's had a rise in his PSA. We did talk about this last week. We know that PSA, the prostate blood test, are one of the commonest reasons for seeing an elevation in the PSA that's not related to prostate cancer is urinary tract infection. So often men have had the PSA drawn in the presence of infection, and that can result in a very abnormal reading. His PSA has jumped up quite significantly from 1.86 to 5.86. Tina, first thing I would do with a gentleman like this is make sure he doesn't have a urinary tract infection. Comments?
Absolutely. I think it is very, very important that he's getting regular checkups, and it's very important for his urinary tract health to use the cranberry juice to monitor the PSA just to make sure that it's not one value. So I'm sure they'll do regular tests, but again, it's extremely important that he does prevention for his urinary tract health because he's obviously more prone to getting urinary tract infections, and he needs to take the steps to prevent those UTIs.
And we certainly know with men that the prostate can be a big problem of predisposing men to urinary tract infection. Just tell us a little bit about how the prostate can be related to urinary tract infections.
Sure. So as you get older, the prostate gets larger and larger, and this happens in almost all men. So, and the urethra, what I was talking about before, runs through the prostate. And so as your prostate gets bigger, it essentially presses on the urethra. And when you press on the urethra, the bladder starts to retain urine. And as you retain urine, you start to get more urinary tract infections. That's why, as Dr. Howell was saying, it's very important to flush that bacteria out, to take the cranberry products, to take UT, and to keep that bladder clean.
And certainly I think that's why it's important to emphasise for patients who are having particularly recurrent urinary tract infections, they do need proper evaluation by a urologist to see whether it's the same bacteria each time, are they emptying the bladder, what's going on with the prostate, what's predisposing them to urinary tract infections, do they have other medical problems like diabetes. Amy, we have a caller for you, which I think would be a very good call to take from Adele in Brooklyn. Good morning, Adele.
Hello.
Good morning. You're on Katz's Corner, Adele, with Dr. Tina Wu and Dr. Amy Howell. What's your question?
Okay, good. Yeah, I get very frequent urinary infections. However, I'm also taking Coumadin for AFib. And I was told that since I'm on Coumadin, I shouldn't take cranberries.
Okay.
Any solution or any different form that I could take them in?
Sure. Well, I'm going to hand that question over to Dr. Amy Howell, who's a cranberry researcher who has been studying cranberry for many, many years. She'll be able to answer your question, I'm sure. Amy, over to you.
Hi, Adele. Yeah, we get that a lot, and there was several reports of an interaction between Coumadin, warfarin, the blood thinners,
Right.
and cranberry. And since that time, several large-scale trials have been done looking at this problem just to make sure. And the conclusion has been that they're really, at normal serving sizes, several times a day, there is really no interaction to worry about. So what happened was that a lot of these pharmaceutical companies and drugstores kind of jumped the gun and put a warning on their products interacting with cranberry, and that has shown to be not the case. So you're fine.
And just tell us a little bit about UT, because I've certainly used this with my patients. And for those of you who are on the internet, go and have a look at the website, www.drinkut, that's drinkyout.com, because that website's got a lot of information about urinary tract infections, but also about the cranberry supplement that has been shown to help so many patients with urinary tract infection. Amy?
Yeah, interestingly, I've looked at hundreds, literally, probably most of the cranberry dietary supplements and juices and things that are on the market for consumers. And there is a wide variation in not only potency, but shelf life, stability, all these kinds of things. And this is important because people are spending their money on these products and they want them to work. So that's what we devote a lot of our lab research to. And this particular product, I have done quite a few studies on it, called UT. And it's very...
Is that like just the letter U dash T?
So it's
YOU-T is the product. So there's information on the internet at drinkut. That's drinkyout.com.
But the nice thing about this product is that it comes in individual little packets, and it's low in sugar, really no sugar, because cranberries have very little sugar to begin with, so you don't have to worry about that. But we have found it's extremely effective at preventing these bacteria from sticking in your urinary tract, which is what you want.
Thanks very much for your call, Adele. I have a quick question, Amy. We know that E. coli is the commonest bug that causes urinary tract infection. Is cranberry good at preventing all types of urinary tract infection, or is it just the E. coli infections?
Well, up to 90% of UTIs or urinary infections are caused by E. coli, so you're covering quite a few of them.
Okay. Let's go to another caller. Let's take a call from Kathy in New Jersey. Good morning, Kathy.
Hello.
Good morning. You're on Katz's Corner, Kathy, with Dr. Philippa Cheetham, Dr. Amy Howell, and Dr. Tina Wu. Do you have a question for us?
Yes, I've been having chronic UTI since October and have been on a pretty much constant regime of antibiotics, so I understand what you're saying, and I'm afraid of the resistance as well. I was wondering about a product called D-Mannose, M-A-N-N-O-S-E, about its effectiveness as well as the cranberry.
And are you taking this at the moment, Kathy?
I am.
Okay, and how long have you been taking this?
I would say for 6 weeks.
Okay. And you've seen a urologist, have you?
Yes, many times.
Okay, and they've done scans to make sure you don't have kidney stones, that you're emptying your bladder properly.
I've had CAT scan.
And they've looked inside the bladder with a cystoscopy, have they?
They have. Not recently, but they have. But I've been seeing the doctor monthly.
Okay, and do you have any other medical problems like diabetes that predispose you to infections?
No.
Okay, let me ask Amy about your question on D-Mannose. Thanks for your call, Kathy. Amy?
Yes, Kathy. The issue with D-Mannose is that it's a sugar. And what they've seen in the research is that if you do it in the lab and you mix the D-Mannose with the bacteria, it will prevent the adhesion of these bacteria. But when you consume D-Mannose, and you have to take quite a bit of it every day to see any benefit, up to several tablespoons, and this is a sugar. And so what's ending up happening is you're going to end up getting into a pre-diabetic condition, because you're going to have to be taking this every day, and a little bit's just going to be spilling into the bladder because sugars are broken down before they reach the urine. So a better alternative would be to try a product like UT that has some research behind it. We know it works, and it's effective, and it basically does the same thing but only better.
And the potency of the cranberry extract in the UT is hugely greater than all of the products that you see on the shelves in the health food shops.
Absolutely.
So you're thinking that D-Mannose can actually be dangerous for me?
It might not be dangerous, but you're setting yourself up for some potential issues. And I would recommend, just based on the research, that you switch over to a good cranberry product like what we're recommending.
And what is the name of your product?
It's not my product, but I've done research on it. It's called UT.
Okay. And it's really frustrating, I have to say, this constant urinary thing.
Kathy, let me just ask Tina to chip in here and give some extra information about prevention of urinary tract infections. Just hold on there, Tina.
Thank you.
So I think that, like Dr. Howell said, drinking a cranberry product like UT, so you can go to www.drinkut.com and find out a lot more information about urinary tract infections. But some ways to prevent urinary tract infections: one, hydrate, hydrate, hydrate. So that's why we do recommend UTs. It's a little stick pack, and you just pour it into 12 ounces of water. Stay hydrated.
And elderly people, particularly, they don't like to drink water, do they?
Exactly.
They tend to be very on the dehydrated side.
Right. Elderly people, they don't have the thirst receptors. They start to essentially get dull over time. So elderly people need to sometimes force themselves to drink.
What about other prevention tips for Kathy and other women out there who are prone to urinary tract infections?
So hydrate, hydrate, hydrate. Urinate before and after sex. You can always take showers and take baths, but also wipe when you're, for women in particular, wiping from front to back. That's also very important. And there's always stay clean, urinate after having sex, and also drink a lot of cranberry products, especially ones without sugar.
Okay, great. Thanks for your call, Kathy. Let's go to Helen in New Jersey. Helen, I understand you have a question about your husband with a bladder infection. Good morning.
Yes, good morning. How are you? I really, truly, and honestly have learned so much from listening to your show on Sunday mornings.
Well, thank you very much. You have a question for us, Helen?
Yes, ma'am. My husband's just recovering from a urinary bladder infection that he had for 2 weeks. He was on Cipro, which relieved him from the problem. What I don't understand is when this is the second bout that he's had in 2 years, the urine just drips constantly, and he has to wear a pad until he recovers from the infection. But my question is it better to give him a tablet for the cranberry tablet, or because he doesn't like to drink? He's 69 years old. I mean, to me, he's only 35, but he's 69 already. So I'm just wondering which would be better, the tablet or a handful of cranberries, dried, dehydrated cranberries. He enjoys them. He enjoys the dried ones, but I don't know which is easier.
Okay, that's great. Well, thank you very much for your question. Well, first thing that's running through my mind here is a gentleman who's got some incontinence as well as an infection. Certainly, infection can cause incontinence, but often incontinence can be a sign of incomplete bladder emptying, what we call chronic retention. And if you're not emptying your bladder and urine is left behind, whether you're a man or a woman, it certainly can predispose you to urinary tract infections. To answer the question that you've asked, Helen, I'll ask Amy. She's asking about cranberry, different types.
Yes, it is possible to utilize, because UT is a powder. So you have the option of mixing it with water or mixing it in with a food, maybe oatmeal or yogurt. So if he has problems taking the extra fluid, there are the other ways to consume this. And the fact that it has been tested in the laboratory and on humans means that you're going to see an effect.
And for those people who are just tuning into the show, we're talking about cranberry, urinary tract health, urinary tract prevention, how to prevent urinary tract infections. Just explain again about how the cranberry prevents urinary tract infection.
Well, when you consume cranberry, the compounds in the cranberry get into the bladder and they prevent the bacteria from sticking to the walls of the urinary tract, which this is the first step in the infection process. So if you can prevent that step, you will prevent the infection from progressing and the bacteria are flushed out of your body in the urine stream.
And any concern about taking large doses of cranberry extract while you're on antibiotics, any interaction with other medications? A previous caller mentioned Coumadin. Any other medications that you'd be concerned about taking cranberry extract?
There are several studies that have looked at the interaction with antibiotics, and they have not found any. So it appears to be quite safe. Okay,
great. So if you are wanting extra information, please have a look at the website, www.drinkut.com. drinkyout.com. That's drinkyout.com. There's some very useful information on there about urinary tract infections, why we get urinary tract infections, why we're prone, how we can actually prevent them. Some very, very useful information on that website. And if you want to know more about how prostate can result in urinary problems, come to our men's health seminar. We're going to be talking a lot about integrative medicine and prostate health prevention and keeping a healthy urinary tract. That's our men's health seminar, Father's Day weekend, Saturday, June the 15th. Let's see if we can take another call. I think we've got Ralph back on the line from Queens Village. Good morning, Ralph.
I'm sorry I missed you just a minute ago. Anyway, I had called last week. I was the last caller, and I had passed a kidney stone. I don't know if you remember me.
I do remember, Ralph.
How are you? Thank you for taking my call. Anyway, what are the preventive measures, maybe diet, to prevent kidney stones?
It's a great question, Ralph, and we've done a show previously talking about how you can prevent kidney stones naturally. And again, there are some common threads here between diet, lifestyle. We've also talked about some of the issues with urinary tract infections today. Tino, maybe you want to chip in a little bit on this as well, but certainly with kidney stones, we need to know the type of kidney stone. Again, it's very important to drink plenty of water, keep the urine as dilute as possible. We know that certainly red meat can increase your risk of having kidney stones, and foods that are rich in oxalate. Just want to ask you about this, Amy. We know that cranberry is very rich in oxalate, and patients who are prone to kidney stones are often advised to keep a low oxalate diet. So a bit of a conflict here. Comments on that?
It is. Many of the foods that are quite nutritious for us have high oxalate levels, but the reviews and the studies really don't show that there's much of an interaction. In fact, with certain kidney stones, cranberry is actually helpful.
Such as which kidney stones?
Well, there's oxalate and Tina.
One of the most common, calcium oxalate.
Yeah.
Those kidney stones.
There's the music, guys. Fantastic guest, Dr. Amy Howell. Excellent cranberry research information there. Dr. Tina Wu from NYU. Thank you.